I grew up in Salt Lake City, Utah. I have multiple family members in the medical field. I have a sister who's an ophthalmologist, and two of my sister's husbands are also surgeons, and this exposed me to the field of medicine from a very young age. I've always enjoyed the sciences, particularly the mechanical sciences. I studied physics and engineering in college. About halfway through my college career, I actually sustained an ACL tear from a skiing injury. And this required surgery, which exposed me to the field of orthopedics. I really enjoyed the interaction I had with my surgeon and felt that orthopedics would be a rewarding field where I could apply my knowledge of the mechanical sciences to helping improve the lives of others. So I did medical school at Vanderbilt University, which is one of the top teaching and research programs in the country. Following this, I did an orthopedic residency at the University of Arizona. Following residency, I did a sports medicine fellowship at the University of Southern California. There I worked with multiple world-renowned leaders in sports medicine. We worked with the sports programs at the University of Southern California, including the football team, as well as multiple colleges throughout the Los Angeles area. We also worked at the Kerlan-Jobe Institute, which is a very well-known sports medicine clinic in Los Angeles, where many professional athletes go to seek medical care. The field of orthopedics, we're dealing with the bone and joints, which is very mechanical in nature. So I really enjoyed being able to apply the mechanics and physical sciences I learned in college to the field of medicine. So I've always really enjoyed working with my hands. I enjoyed wood shop growing up, constantly working on motorcycles and cars, and orthopedics really meshed well with that. I've also had a very active lifestyle. I participate in multiple outdoor activities, including skiing, mountain biking, kayaking, and really enjoy being able to help people return to active lifestyle. So I've been in practice in Burien for 5 years now. My practice consists of a pretty equal distribution of sports medicine, joint replacement, and also trauma or fracture care. Sports medicine, if surgery is necessary, involves more minimally invasive procedures or arthroscopic procedures using very small incisions, which allow for less surgical trauma, quicker rehabilitation, and the surgeries are largely performed at our surgery center, which is an outpatient surgery center, allowing for patients to go home the same day. I also perform joint replacement surgery of the hip, knee, and shoulder, as well as fracture or trauma care involving acute broken bones. The term sports medicine can be a bit of a misnomer, but the field of sports medicine involves the treatment of athletes, but also involves people that may have sustained work injuries or injuries just around the house. So involved with that, there is the process of formally evaluating the patient physically and reviewing their imaging, establishing the correct diagnosis, and then once a diagnosis is determined, we can discuss treatment options. So I like to involve my patients in this process, so discussing with them the various treatment options, whether that is doing rehabilitation or possibly involving surgery. If surgery is necessary, this typically involves more minimally invasive procedures. This is largely performed at our outpatient surgery center, which allows patients to go home the same day and also ultimately provide better outcomes. So I currently perform joint replacement involving the shoulder, hip, and knee. I perform the anterior approach total hip replacement, which allows us to go between the muscle planes as opposed to having to take down muscles and tendons to perform the surgery. This allows for less surgical trauma and quicker recovery. It also allows for us to check the position of the parts under X-ray guidance, and also allows for less restrictions after the surgery. I also perform joint replacements using patient-specific imaging. This allows us to use this information to plan the surgery and make the correct cuts in the bone to allow for proper positioning of the implants. I've also been trained in minimally invasive techniques. These involved smaller incisions, less surgical trauma, which allow for quicker recovery, earlier rehabilitation, and overall better outcomes. Growing up, I was very active. I was an avid outdoor athlete. Unfortunately, because of this, I've sustained a fair number of orthopedic injuries myself. I've torn my ACL, ruptured my patellar tendon, broken my clavicle, had several other broken bones, all requiring orthopedic treatment. This has allowed me the unique opportunity to experience what it's like to be an orthopedic patient. I understand how devastating it can be to sustain an injury like this. I understand the fears and anxieties involved with possibly needing a surgery. I understand how hard the rehabilitation and healing process can be, but I also understand what it's like to fully recover from this process and return to an active lifestyle. Being able to participate in this process is very gratifying to me.